Have you ever stopped to think about, the silent struggles our animals might be going through? Especially horses. They're just masters at hiding pain, aren't they? Incredibly stoic. It makes it so tough for us to even know when something's wrong. Well, today we're actually diving into a specific condition that causes really significant pain in horses, but it often goes unseen. Welcome to the Deep Dive. This is the show where we take source material, dig into it, and pull out the most important bits of knowledge and insight for you. Basically a shortcut to getting really well informed on a topic. And today, we're tackling something pretty important for anyone involved with horses. Equine tooth resorption and hypercementosis. ETRH for short. We've got some really good, solid sources to work from today. Excerpts from Equine tooth resorption and hypercementosis, a comprehensive guide, and also a specialist-level study guide on it. So our mission is to unpack this really complex and, frankly, often painful condition. We want to help you understand what it is, how it affects horses, and what the latest thinking is on diagnosing and managing it. Hopefully you'll have a few aha moments along the way. Okay, so let's get into this. What exactly is ETRH? It just sounds, well, complicated.
It really is quite a puzzle. ETRH is a severe dental disease. It's progressive, meaning it gets worse over time, and it's definitely painful. It mainly hits the incisors, the front teeth, and the canine teeth, usually in older horses.
Okay, older horses, front teeth.
Right. And what's really unique, kind of paradoxical even, is its dual nature. You've got two things happening at once. There's resorption, where the horse's own body starts breaking down the tooth structure and the bone around it, both inside and outside the tooth. And then there's hypercementosis, which is this excessive, irregular buildup of cementum, which is part of the tooth root.
Whoa, wait, so the body is destroying parts of the tooth, but also trying to build other parts up, kind of haphazardly.
Exactly. That's the core of it. It's like tearing down walls in one room while frantically adding weird, lumpy concrete patches in another spot on the same structure. It's this contradictory battle.
That sounds incredibly destructive and painful.
It is. And this sort of simultaneous destruction and faulty repair is what makes it so challenging. We actually see similar things, believe it or not, in humans. Certain types of root resorption, and famously in cats, with something called feline odontoclastic root resorption syndrome.
Okay, that explanation to what it is definitely paints a picture. A pretty uncomfortable one. So the next big question for horse owners, I imagine, is, well, who gets this? Which horses are most at risk, and maybe why does it even happen?
Good questions. So looking at the signalment, that's just the vet term for the typical patient profile, age, breed, that sort of thing. ETRH mainly affects horses generally over 15 years old. That's the typical age range, although we do sometimes see it in younger horses too. It's not exclusively an old horse disease.
15 and up, mostly.
Yeah.
Any particular breeds?
Well, there isn't super strong evidence pointing definitively to one breed or sex, but anecdotally, based on what vets see in practice, there are suggestions that maybe warm bloods, Morgans, Friesians, some pony breeds might pop up a bit more often. Some reports also mention male horses or geldings, and Icelandic horses potentially being more susceptible. But again, nothing definitively proven across the board yet.
Okay, so mostly older horses, maybe some breed hints, but nothing set in stone. What about the why? Why does this start?
The pathophysiology. Well, that's where it gets really tricky. The honest answer is the exact cause, the etiology, is likely multifactorial, meaning there probably isn't just one single trigger. We don't fully know what all the factors are. It's a huge area of active research right now.
So no simple answer yet. What are the leading theories then?
Right. We have several strong hypotheses. One big one is mechanical stress or trauma. Think about chronic forces on those front teeth. Things like crib biting, or maybe teeth that don't line up properly, malocclusions, even excessive pressure from a bit, or just the fact that as horses age, their incisors naturally wear down and have less reserve crown below the gum line. All this could put extra strain on the periodontal ligaments, the tissues holding the teeth in their sockets.
So just the daily grind, literally, could play a role. Or habits like cribbing. What else?
Another major area researchers are focusing on is infection and inflammation. Periodontal disease, gum inflammation seems to be a really common starting point. In fact, studies have found specific types of bacteria, sometimes called red complex bacteria, particularly species like Treponema and Tannerella in the affected teeth of horses with ETRH.
Red complex. Aren't those linked to severe gum disease in people too?
Exactly the same group. Finding them there strongly suggests that this kind of deep-seated infection and the resulting inflammation are probably key drivers of the ETRH process. And beyond that, people are looking into other potential factors too. Possible links to things like Cushing's disease, maybe a genetic component, immune system issues, problems with the periodontal ligament itself, even blood supply disturbances. It's complex.
So it sounds like this vicious cycle gets going. Maybe some stress or inflammation starts it,
Yeah.
and the body's resorption cells, odontoclasts you call them, start breaking things down.
Right, the odontoclasts get activated.
And then in response, the body tries to repair it, but does it excessively with this hypercementosis, making things even worse, like a runaway train, as you said.
That's a really good way to put it. It's a continuous cycle of inflammation, destruction, and this abnormal, excessive repair attempt.
Okay, this brings us to something really practical for owners and caretakers listening. How would you even notice this? Especially if horses hide pain so well. What are the signs we should be looking out for?
Yeah, that's the million-dollar question, isn't it? Because the signs can be so subtle, especially early on, and they tend to creep up slowly. You really need to be observant and have a high index of suspicion.
So what kind of subtle things?
Often it might start with behavioral changes. Maybe your normally sweet horse gets a bit irritable or head shy, perhaps suddenly reluctant to have the bridle put on or fussy with the bit, sometimes even head shaking.
Okay, behavioral stuff. What about eating? That seems like an obvious place to look for teeth problems.
Definitely. You might notice they're having trouble grasping harder feed, like whole carrots or apples. Or they might seem less keen on using their front teeth for grazing. Dropping feed while chewing, we call that quitting, is another classic sign. They might start preferring softer feeds like mashes or soaked hay. And sometimes you might see subtle, unexplained weight loss.
Quitting, preferring soft food, weight loss. Got it. Any signs actually in the mouth?
Yes, though getting a good look can be tough if they're painful. You might notice things like excessive drooling, bad breath halitosis. And sometimes you'll see horses doing this funny thing where they just kind of rest their tongue between their front teeth, almost like they're trying to cushion them or relieve pressure.
Resting the tongue between the incisors, that's specific. And if a vet examines them?
A thorough oral exam, often needing sedation because of the pain, might reveal more obvious signs. Things like really red inflamed gums, severe gingivitis. The gums might be pulling away from the teeth, what we call recession. Sometimes the gum tissue actually overgrows, that's hyperplasia. You might see little draining tracts like tiny holes in the gum, leaking pus, lots of tartar buildup, feed packing around the teeth, maybe the teeth feel a bit loose. And sometimes, especially with that hypercementosis, you can actually see or feel this kind of lumpy, bulbous enlargement of the tooth root area right under the gum line.
Wow, okay. So there are clues, but many are subtle or need a vet's eye.
Exactly. And given that subtlety, especially early on, and the fact some signs could be caused by other things, well, that leads us to diagnosis. How do we know it's ETRH?
Right. It sounds like just looking isn't enough to be sure. So what is the definitive way? What's the gold standard for diagnosing this?
You nailed it. Clinical signs alone, just looking and observing, they're not enough for a firm diagnosis. They raise suspicion, but that's it. The absolute cornerstone, the gold standard for diagnosing ETRH, is intraoral radiography, basically taking x-rays right inside the horse's mouth.
Dental x-rays like we get.
Pretty much, yeah. But it requires specialized equipment for horses, obviously, and getting the right angles and multiple views is crucial for good images.
Okay, so you take these x-rays. What are you actually looking for on the images that screams ETRH?
We're looking for those two key features we talked about, resorption and hypercementosis. For resorption, on the x-ray, the tooth root might look, well, fuzzy or irregular, kind of moth-eaten around the edges instead of having a nice, clean outline. You might lose the image of the thin white line of bone that normally surrounds the root socket that's called the lamina dura. You might see dark spots, lucencies around the root tip indicating bone loss. Sometimes the roots even look shortened or blunted.
Moth-eaten roots missing bone lines.
You okay?
And the hypercementosis.
That shows up as increased density on the x-ray, so brighter white areas, and you often see that characteristic bulbous enlargement of the root. The root loses its normal tapered shape and just looks big, bulky, sometimes almost lumpy or club-shaped.
Wow, so the x-rays really show that destructive rebuilding battle.
Heck, they really do. And here's a critical point. You can often see these radiographic signs of ETRH, the resorption and hypercementosis, even in teeth that look perfectly normal on the outside during the visual exam.
No way.
Yeah.
So a tooth could look fine, but already have the disease starting inside.
Absolutely. That's why imaging is so incredibly important. It goes way beyond what we can just see or feel. And for really complex cases, or if we're planning surgery, sometimes even more advanced imaging like CT scans, computed tomography can be used. That gives us a full 3D picture of the teeth and bone.
Okay, so x-rays are key. We know what it is, who might get it, the subtle signs, and how to diagnose it definitively. That leads us straight to treatment. What can be done for these horses, especially considering how painful this sounds?
Right, treatment. The number one goal, always, always, is pain relief. Alleviating that discomfort is paramount. After that, we want to eliminate any infection and inflammation and basically restore the horse's comfort and ability to eat properly.
So what are the options? Do you start with medications?
For milder cases, maybe really early stages, or sometimes alongside other treatments, we can use medical management. This definitely includes pain control, usually NSAIDs, things like phenylbutazone, buta, or flunixin meglumine. Sometimes if we suspect nerve pain is involved, we might add drugs like gabapentin or tramadol. And of course, local nerve blocks are crucial for any procedure.
Okay, pain meds. What else?
We might use antibiotics if there's obvious secondary bacterial infection, those draining tracts, for example. Good oral hygiene helps too, maybe using something like a chlorhexidine rinse. And dietary changes are really important, switching to softened feeds, mashes, soaked hay cubes, anything to make chewing easier and less painful.
Softer food makes sense. You mentioned something about mushrooms.
Ah, yes. That's an interesting adjunctive approach that some practitioners advocate for maybe slowing things down in mild early cases. It involves using extracts from a specific type of Brazilian mushroom, Agaricus blazei merle, often combined with vitamin D supplementation. The evidence is still developing, but it's out there as a potential supportive therapy.
Interesting. But what happens when the disease is more advanced? When those medical options aren't enough? What's the definitive treatment then?
That's a really important question. Many owners, understandably, feel hesitant about removing teeth, especially the front ones. They worry about how the horse will cope, how it will look.
Yeah, I can definitely see that hesitation. Pulling teeth sounds pretty drastic.
It does sound drastic, but the reality is once the disease gets worse, when you start seeing lesions above the gum line, or the x-rays show severe resorption, or there's infection in the socket or the bone, or the teeth are loose, or fractured tooth extraction really becomes the most effective, definitive treatment.
So pulling the affected teeth, how is that usually done?
For the incisors and canines, it's often done with the horse standing, using heavy sedation and really good local anesthesia, blocking the nerves to numb the area completely. Sometimes, for very difficult extractions or if many teeth need to come out, general anesthesia might be needed. And often it requires surgical extraction because of that hypercementosis, making the roots big and bulbous, and sometimes they even fuse directly to the bone, that's called ankylosis. They can be incredibly hard to get out otherwise. So the vet might need to remove some bone to get the tooth out cleanly.
Surgical extraction.
Yeah.
Okay. That sounds intense, but necessary sometimes.
Yeah.
What's the outcome usually after the teeth are out?
This is the key message for owners who are worried. The outcome regarding pain is generally excellent. Most horses experience really significant pain relief, often quite quickly. You see this dramatic improvement in their comfort, their behavior, their willingness to eat, just their overall quality of life. It can be truly remarkable to see the change.
So the pain relief is significant. That must be a huge comfort to owners.
It really is. And healing is usually pretty straightforward, too. The sockets typically heal up within about 3 to 4 weeks without major complications.
Okay, that's reassuring. So let's talk about life after ETRH treatment, especially if extractions were needed. What should owners expect?
Yeah, that's crucial. What does life look like for a horse post-extraction?
My first thought is, how do they even eat without their front teeth? That seems like a massive adjustment. Do they manage?
They really do. It surprises a lot of people, but horses generally adapt remarkably well. They learn pretty quickly to use their lips to grasp feed, like grass or hay, and then they use their tongue to move it back to the molars, the cheek teeth, for grinding. Initially, some dietary changes might be helpful, like providing chopped hay or soaked feeds, especially if they were heavy grazers, but most adapt brilliantly.
They learn to use their lips and tongue instead. Fascinating. Any other changes owners should know about?
Yeah, a couple things we always tell owners.
Yeah.
First, right after surgery, they might have a little trouble figuring out how to grab feed, so patience and sock food are key. And second, it's really common for horses that have had their incisors removed to play with their tongue more. It might just hang loosely out of their mouth sometimes. That's totally normal, just an adaptation to the new space. Doesn't usually cause any problems.
Good to know that tongue thing is normal. So looking forward, is there anything at all we can do to prevent ETRH in the first place?
Unfortunately, right now, there aren't any guaranteed prevention strategies. Because we don't fully know the exact cause, it's hard to say, do this and your horse won't get it. However, the best approach we have currently is really early detection. And that comes down to routine, comprehensive veterinary dental exams.
Regular checkups.
Exactly. Having a vet thoroughly examine the horse's mouth regularly, especially as they get older, is key. And maybe promptly treating any gum disease that pops up or correcting significant malocclusions might help by reducing some of those potential inflammatory triggers or abnormal stresses. But the main thing is catching ETRH early, if it does start.
So early detection is the best defense right now. What about the future? Where is the research heading?
There's a lot of ongoing work. Researchers are really pushing to understand the exact etiology, the root causes. That's fundamental. They're also looking for non-invasive biomarkers, maybe something in blood or saliva that could help diagnose it even earlier, before X-ray changes are obvious. There's hope for pharmacological treatments down the line, drugs that could actually halt or maybe even reverse the disease process itself. That would be amazing. Imaging continues to improve too, things like cone beam CT, which gives great detail with potentially less radiation. And genetic studies are underway, trying to identify if certain horses are genetically predisposed, which could lead to targeted prevention someday.
Lots of promising avenues then. It sounds like there's hope for better understanding and management in the future.
Definitely. There's a lot of dedicated research happening.
Well, we have certainly taken a deep dive today into ETRH. It's clearly a complex, definitely painful, and progressive condition affecting typically older horses. I think the biggest takeaway for me, and hopefully for you listening, is this. Yes, ETRH is a serious challenge, but by understanding those subtle early signs, using the right diagnostic tools like those crucial intraoral X-rays, and then pursuing the right treatment, which often does mean extraction for advanced cases, we can achieve really profound pain relief and dramatically improve the quality of life for these horses.
Absolutely. And maybe one final thought to leave people with. Horses are just incredible at hiding pain, right? Their stoicism is remarkable, and that very stoicism makes ETRH and probably other painful conditions too so hard for owners to spot early on. It really hammers home how vital those regular professional vet dental exams are, particularly for our senior horses. It also makes you wonder, doesn't it? What other subtle signs of discomfort might our animals be showing us across all species that that we're missing simply because they're so good at putting on a brave face?
That is a powerful point, something definitely worth reflecting on. Thank you so much for sharing your expertise today, and thank you all. Feedback. Any questions?